Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to our Is This Normal Menopause edition. Today I wanted to talk about some things that women in the perimenopausal and menopausal age group are going through. And these changes can be kind of gradual or they can be more sudden, and it kind of can throw a woman into a little bit of confusion about what's going on, and they may not be sure, and it could sort of dissociate them from physically and even psychologically confusing them. So I wanted to go over some of the most commonly asked questions that I find in women in this age group, and that's stemming from early 40s into late 60s. So women in their early 40s and you're starting to see some changes in your body, sometimes that can be hormonal shifts more than anything else. So let's tackle them. The first one I wanted to get into, I see constantly, is the patients ask me, I come in because I'm gaining weight and I don't know why. I eat the same, I exercise the same, I have the same lifestyle. I'm not sure, but suddenly my weight is shifting. And many times that's because hormonal changes in your body are changing your metabolism. And it doesn't mean you have to starve yourself or go to the gym 5 hours a day for every day of the week. You need to see your gynecologist or your PCP and have your hormones checked, because sometimes just going on low doses of hormones can change that metabolism, and you'll find that your weight may come into, a little bit more normal for you. The other thing is it's really popular to start taking the GLP-1s, like Ozempic, that a lot of people are on nowadays. You have to be careful with this because you have to make sure that you're eating. And so we'll talk about some of that and how that can affect women of all ages, but especially women in their perimenopausal, menopausal age groups as well.
Why is my skin suddenly thinner, crepey, or sagging?
So it's another common issue. So women start to see in their, usually around early to mid 40s, some changes, mostly in their face and sometimes even in their upper arms, where the skin's starting to get a little bit thinner. And what ends up happening is after early 30s, for both men and women, the dermis, the deep part of the skin, starts to thin over time. Women with the estrogen and progesterone can kind of start to thin that dermis faster than men, and also women have less dermis than men from the start. So as your hormones shift, you'll see changes in your dermis, and so that's what causes that little bit of loss of elasticity, that little bit of thinning of the skin. You might start to see some changes in your face and mostly in your neck area, where you start to see a little bit of crepiness, especially under the eyes as well. So for those types of patients, there's different ways that we can treat that. Not all of them are surgical, depending upon where you're at along that pendulum, that sometimes we can just treat your skin, mostly with lasers. We can try dermal fillers. There are radiofrequency microneedling devices that we have called Virtue. We have another one called Everest that it's a bulk heating of the soft tissue and the dermis using radiofrequency. That's something we've recently added, and we've seen good results with that. So we can stimulate that skin and tissue and try to build up that dermis, but it has to be stimulated over time. It's not a one and done. Moving along, sometimes dermal fillers can add volume back in certain areas to help give you some of that lift. And then lastly, you're looking at a surgical correction along that pendulum as things continue to progress.
Is it normal for my face to look more hollow or sunken than before?
Yeah, and that goes along with that thinning of the skin and the dermis, as we all lose volume in our face as we get older, even men. And so what ends up happening, there's a fibrofatty layer in our faces that lives under the skin and on top of the muscle. A lot of people know we call the SMAS layer. And that's what gives us our bulk of our cheeks and along the lower jaw as we're younger. As we age, that will start to thin and the attachments start to loosen. So the tissue now moves down and forward, resulting in deepening of the folds around the mouth called the nasolabial folds. You can begin seeing lines by the chin called marionette lines. You're going to start to see jowling. That tissue is not extra skin, it's actually that SMAS layer that's coming forward. Same thing with the changes in your cheeks here that used to be back here. starting to slide under the skin. And then with the crepiness and that loss of elasticity of the skin of the neck, that starts to move down. Again, it doesn't always have to be a surgical correction. Some of the modalities I just spoke about, Virtue, that microneedling radiofrequency, the Everest, which is bulk heating with radiofrequency, can also help restore some of that volume even with dermal fillers, kind of give you that lift again, depending upon what your goal is. And at some point, you may consider a surgical change, which would be a facelift or a neck lift.
Is it normal to feel changes in my breast shape or skin texture?
Right. So as we age and as women hit menopause, it's top to bottom. So you're going to see changes all over your body. And so your breasts are one of those areas because, again, breasts are hormonally stimulated. And so over time, women will start to lose breast tissue, and we call that involution. So what a lot of women will start seeing is that the concavity of the upper part or the upper pole of her breast, you might even see your breast kind of shrinking down a little bit, losing some volume, excess skin, a little bit of sagging, which we call ptosis. So you might see changes with that. You also might start feeling some sensitivities in your breast, which is normal. I want every woman to do at least monthly exams. It's the most sensitive way of finding out how your breasts are changing. Again, 1 in 8 women are developing breast cancer, and most of those are found by women on their most just everyday self-examination. And then I want you, if you do feel something that's abnormal, gynecologist, primary care physician, you need to make an appointment and see them. So I want you to be sensitive that there are changes in your breast. Most of the time, those are very normal, but it should be checked out. And I would suggest also yearly mammograms. I know they're not comfortable. I know it's not something that any woman would want to go through, but they're extremely important. And I encourage every woman at the age of 40 and beyond, if you're not high risk, to be doing that.
Is bloating or feeling puffy more often a normal symptom of menopause?
Yes, it can be. So it can be related. There's no doubt about it, especially if you haven't had that in the past and now suddenly you're in that age group where things are changing, your body's going through these changes. It could be subtle things like I feel puffy, I'm not digesting my food as well. So those are things, again, seeing your primary care and seeing your gynecologist to have just sort of a checkup, basic labs, hormone studies can kind of help you out. Again, getting back to the GLPs like Ozempic, some patients are helped by those medications. And so I've had a lot of success with patients that start to feel improvement in their digestion, and that puffy or bloated feeling will resolve. I've had a couple of patients that have been on the medication from other physicians, and they actually impacted their bloating and actually made them feel worse, and they felt better when they came off the medication. So again, you need to be monitored. When you're taking these GLP-1s, they are great medications, but they have to be monitored. I see so many patients getting it across state lines, getting it online with these online doctors. You're not really being monitored like you need to be. I always suggest that your primary care, your gynecologist, somebody that's going to be monitoring you every few months and go over some of these symptoms, because sometimes that can be part of the medication issue more than the hormone changes from menopause.
Why does it feel harder to lose fat or build muscle after 45?
That happens with men as well. But in the menopausal women, one of the most common areas that I'm seeing this sort of buildup of fatty tissue is in the upper part of the abdomen, above the belly button, below the lower rib cage. You're starting to see this thickening, and it almost feels more fibrous than the fatty tissue below the belly button. A lot of women say when they sit down, it's very uncomfortable. It feels like it's pushing up underneath. So in those situations, really the best treatment of that is liposuction. I've had women come in, they've tried cool sculpting and other non-surgical methods. Sometimes that can make it worse. The GLP-1s, I've seen sort of plus minus with that, and I'm not opposed to trying it, but sometimes those are sort of resistant. You could also get those in the fatty deposits in your upper arms, your thighs, your saddlebag areas, which is on the outside part of your thighs. So it doesn't have to be confined to the upper abdominal wall. It can be anywhere on the body. That's just the most common place I'm seeing it. I know liposuction works very well with it, but like I said, sometimes starting with some non-surgical medications might help you as well. But as we age, again, our metabolism changes. So for women, you have to start thinking about, am I eating enough protein as well? So as women age and their diet sort of changes, a lot of times you're not taking in enough protein. So your diet might have to change, especially, again, getting back to those GLP-1s. Those medications work by slowing down your stomach emptying so you feel full, so you don't want to eat, and so you're going to have to force yourself to eat. The problem is that you're not going to be taking in enough protein. So a lot of times women will see it more than men, where they start to feel fatigue, their hair starts to thin, they might start losing hair, changes in your skin and your nails, because all of that protein and some of the vitamins that you would be normally taking up in your intestinal system, you're not providing those nutrients. So the other thing that can hit women is a loss of calcium. So you can start seeing changes in your bone density. So you really have to be careful on these medications at any age, but especially in that perimenopause, menopausal age group. You really have to be careful about your diet. And that's why I want you to be monitored by a physician who's nearby, because you need to talk about that. At our weight loss and our GLP program, we have you meeting with a licensed dietitian who's well known in the area. She sits with you, she goes over that, your diet, how that might change, and your diet is going to be different from the next person. So not everybody gets the same diet plan, but we need to maximize your intake. So women that are working out might be losing muscle or not gaining muscle. Is most likely at that point because of your diet.
Is it normal to have itchy skin or more sensitivity to products I've used for years?
Yeah, because your skin changes as hormones change, and also the time of the year, depending upon where you live. With the dry air in the winter and a little bit moist air in the summer, that might change. But as we age, again, both men and women, but more in women after hormonal changes, it really affects your skin. So your skin may be drier. It may not be as sensitive to some of the medications that you were using topically. It might be giving you more rashes. You might have itching that you didn't have before. So you might have to, again, talk to your dermatologist or your plastic surgeon about the medications that you're using topically. You might have to adjust those. You might have to go down to a lower dose, especially if you're on a Retin-A type product. They can be very drying in the winter, and as your skin changes and thins a little bit, you might have to go down to a smaller dose.
Why do I feel like I've aged overnight? Is this normal in menopause?
Yeah, because again, those changes come on to you, and the women that I've talked to, and this has been going on for years, it really doesn't come on slowly. I mean, you notice it almost right away. And so things change so abruptly that you start to notice, again, mostly in the skin, that crepiness, the changes in the skin, fat distribution changes, and you don't feel comfortable in your own skin anymore. You start looking at yourself a little more critically. And so you start to feel like you're aging. You're not youthful anymore. You're starting to have even joint pain. You're having, everyone comes and says, I'm just getting arthritis. And it could just be that you're just not, your joints are being affected by the hormones. So you really have to stay fit. You have to stay in motion. Doesn't mean you have to go to the gym all the time or run, but you have to stay in motion. You have to stretch. You have to do those kind of things, and let your primary care or your gynecologist know that these changes are happening. But it isn't uncommon for women to come in saying, I'm not really sure what's going on, but I looked at pictures even just last year, and it feels like I'd aged 5 years. And so again, there's certain things we can do. And sometimes just cleaning up your skin, laser, skin care, those kind of things that will resurface your skin, get rid of that sun damage, bring that luster back to your skin is all you need. And you start feeling better about yourself. So it doesn't always have to be surgical. It doesn't always have to be a lot of money out of pocket. A lot of times there's just some maintenance things that we can start early on. But I would tell you, if you're starting to have any questions about it, see somebody, come in. I'm happy to talk to anybody about this. This is something that we feel very strongly about at Bellissimo. I've noticed it for years. I don't think women get the support that they need. I think women are kind of told, "Wow, maybe you're depressed, maybe you're anxious," and really it could be just shifts in hormones. So I'm happy to go over some things, listen to what's going on, and maybe make some suggestions. And that suggestion might be, let's talk to your primary care physician. Let's get you, back to your gynecologist. This is what I can do in my realm, but we need to work as a team, because I don't think women are being supported enough, and it's not something that's talked about. Talking to women in the menopausal age group, nobody wants to talk about that, because menopause has such a bad stigma to it that they're almost unsure, and they don't know that the symptoms that you're having are common amongst thousands and thousands of women all in your neighborhood. So just ask questions, be your own advocate, and find somebody who is willing to listen to you, whether it's your primary care, gynecologist, whatever. You got to find somebody who is willing to listen to your symptoms, not just write you off with a script, but let's, go through things, work it up, find out what's going on with you, because many times it's not, you feel old, but you're not. I mean, a lot of you women are in your late 40s, 50s, even 60s, where you should be out doing things, running, sports, activities, running with your kids or grandkids, whatever you should be doing, and you don't feel good about it. You don't feel good about yourself. We can change that. It doesn't mean that's just the life you have to lead now. Get some help. We're around to help you. So I hope this helps you. I hope that some of the questions that you had are sort of answered, and you also know that it is normal. It's not just you. There are thousands and thousands of women out there suffering the same way. So if you have any questions, let us know. Type in your questions, go through our website. We're happy to help.